Hey, y'all. Welcome to Questions You Didn't Ask. Did you know that this very spot could be showcasing your business or event? Whether it's an audio ad on our podcast or a visual ad on our new YouTube station, or even both, we've got the space for you. Niasha Fray Consulting is reaching a growing audience of over 1,000 leaders who are passionate about health equity, social justice, and civil rights activism. These are professionals just like you, working across higher education, research, healthcare, nonprofit, government, and even public health sectors. If you're ready to get your message in front of a dedicated and engaged audience, send me an email at niashafrayconsultingllc@gmail.com. Let's talk about how we can help you connect with the people who need to hear about your services and products that advance health equity and wellness. Don't miss out. Get in the mix and let's make an impact together. Welcome to the finale of Doing It for Ourselves, Black Women, Salons, and the Science of Health Equity. I'm Niasha Fray, here with Dr. Schenita Randolph and Dr. Ragan Johnson, as we reflect on what we've learned, what's next, and how each of us can advance health justice. Let's dive in and do it for ourselves. You never know where you're at and how you may be influencing the next generation, or how you might be feeding into strategies to advance health equity. And as Reagan has shared, health justice, building toward health justice by just saying, hey, I see you, sister. Come on over here. I got plenty of people. And I am an opinion leader, right?
Mhm.
They don't listen to me. Just all you got to do is let your arm hang there so she can put stuff on and press it a couple times. She ain't asking for nothing else. Just come on now. And that helped you get to where you are.
Mhm.
All right, Schenita, lean in. Why beauty salons and barbershops?
They're definitely trusted spaces, as Ray
Mhm.
said. It's definitely not a new concept, right? You think about Dr. Loretta Jamont and her work as a nurse scientist around engaging barbershops in her work as well. There are others. It has just historically been that space for communities to have safe conversations. And so it's a natural space. When we think about the sustainability of it, it's a natural space. I think one thing that we have been very specific about, though, why barbershops and beauty salons, and engaging them in ways that are sustainable. Because although it has been a space, as we were talking earlier, is it sustainable? Right? Because they're entrepreneurs now. Much as they love the community, they are about their money.
Yes.
So we're not asking them to be interventionists in this study, right?
Mhm.
We're just giving them the tools to do what they already do. When we think about even our stylists and barbers who have partnered with us, giving them a great big shout out and a thank you
Woo.
to them. We love and appreciate them so very much. They're doing stuff in their communities. Like they're not just curling and cutting hair.
Mhm.
I think about Tamika Hughes, who's one of our
Yes.
partners. She has a nonprofit that she started, Level Up Parenting, where she is really trying to be that resource for single parents, is how it started, because that was her lived experience. She was a
Mhm.
single mom. And so how does she give back? She has started Level Up Parenting. Jean Blackman, who has started establishing safe culture. So these are barbers and stylists are just so engaged in the health and well-being of their communities naturally.
Mhm.
So it's just an amazing space to really partner with them.
That's awesome. I love it. We're going to get into how can stylists, salons, and community members get involved with updos.
Yes, so they can definitely reach out to updos@duke.edu. That's how they can email us and contact us to get engaged. We are engaging 6 counties across the state of North Carolina. Let me see if I can do these without missing one. Durham County, Guilford County, Forsyth County, Mecklenburg County, Cumberland County, Wake. I did it. And Wake County. So right now we are recruiting in the Cumberland County and Wake County areas. And so if there are beauty salons or stylists and owners that you know that are interested, they can reach out to updos@duke.edu to let us know that they're interested in being a part, and we can share more information. We're willing to come have lunch with you, send you information, have a Zoom call to just let you know what those steps would look like. And so they can definitely contact us. I like to say as well that we're partners in creating a platform for Black women because it is a gap. And so really how I'm seeing this is that you're more than a research participant. You're really a partner in creating what Black women need for their health or not need. And I think this has given us an opportunity to see how effective updos would be and will be, and what are some of the gaps and things that we need to consider as limitations in order to fix that. And so we're just asking for the community to partner with us in those efforts.
Yeah, and I think you can also reach out to us on our website or follow us at our website, the HEEAT Lab, HEEAT lab.org/updos.
Yes, and just so everybody is clear, it's UPDOS.
Right.
So not do like your bill is due, DUE. Not that. This is not that. This is
like you're going
like
out for the night.
You going out. You looking cute. UPDOS. Okay, so and remember there's 2 E's in HEEAT. One for equity, one for engagement, then the A for advocacy, and then that T for trust. So that's HEEAT, HEEAT. All right. And so that's a .org. What is that? / or /? It's a slash.
Oh, I don't know.
It's one of them slashes.
Right.
Updos. You figure it out. When it don't go through, try the other side. Okay. So I'm so excited because, by the time that this comes up, we're going to be moving through Cumberland. We're going to be advancing into Wake. We're going to be looking toward Durham and Forsyth and then Mecklenburg. So if y'all are there and you are what we like to call high volume, well-established salons in those counties, hit us up, updos@duke.edu. So before we go, and as we start to wrap up, I love to talk about one, let's think about what are our future plans, and then also let's talk about this. Let's take it one at a time. So now that we know how people can get involved, what are your long-term goals for updos? And what does success look like? I'll start with you, Schenita, with what are the long-term goals? And then Ragan, be on standby for what does success look like?
Yeah. What the long-term goal is that updos will be an evidence-based intervention that can be accessible for nonprofits, other organizations doing health promotion around HIV, and just the lay community to have access to. That it is one that is, again, in our scientific world, it has been proven to be effective. That is the long-term goal. As a researcher, what we realize is that, things can, we're not going to make it be something that is not, right? And so if our results show that there are opportunities for growth in certain areas, our goal then will be to address those limitations.
So one way or another, we're going to learn if it works. And if we learn that there's some things that are not quite working, we're going to move forward. We're making those improvements. The bottom line is that we are here for the community and making sure that Black women know what options are available so that they can maintain and preserve their sexual health in whatever way that looks like for them. Exactly. And so I love that. Ragan, what does success look like? I mean, maybe I said it, maybe not. Give me your idea on what does success look like.
Yeah, I think both of those things, what you and Schenita said, right? I think we could also kind of, if we were looking to measure success, I think our states with the top 10 states or cities that's always highest in HIV, those specifically reproducing updos in some shape, form, or fashion. I think women understanding their choice. Like if we could get to all Black women across the South at least understanding that they have a choice in HIV prevention, I think that would give us some success. And then I think success looks like freedom to choose their method. Like you can choose PrEP, you can choose other things, but just understanding that you have that freedom.
Mm-hmm. If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Fray O. That's buymeacoffee.com/Niasha Fray O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. Yeah, and one thing that we haven't talked about that I think is really important when we're thinking about Black women and HIV prevention is that we don't have to depend on someone else to tell us their status, right, for us to be safe. And I think that's the big part of doing it for ourselves, right? Is if we're scared to ask the question, if we're not trusting the answer, if we're depending on that other person to be honest with us and that doesn't really work out, we have other means and measures to protect ourselves and not have to be dependent on someone else, because there's lots of reasons why people don't tell. Some of those reasons can be assessed as good, and some of those reasons can be assessed as bad. But the point is that whether you're a person that's living with HIV, there's treatment. If you're a person that does not have HIV, there's effective prevention. And so moving the needle on awareness of those things, especially for Black women being able to prevent transmission of HIV, is very, very important. And so I love what you said about freedom. This is also a type of freedom, is not being dependent, right? Mm-hmm. And so we want people to talk, we want people to share. We want people to be truthful and honest, but the data shows that's not what's happening. Mm-hmm. So as much as we want that to happen, we have to provide and innovate other solutions and strategies. And fortunately, medicine, technology, science, research has provided PrEP, which is, how effective is PrEP in preventing transmission?
Up to 99%.
Up to 99% effective. So in other words, if you are a person who is having a sexual relationship with another person who does have HIV, whether you know it or not, if you're having a sexual relationship with them and you're not using condoms and you're taking PrEP, the science says that it's 99% effective in preventing you from contracting HIV from that person. That's powerful. That's huge. It cannot be understated. And so one of the things that we want to do is not give away all of our, secret sauce of our research, right? But we definitely want to make the point about why this research, why this approach is so innovative, so powerful, and why we want people to be involved, and why we are inviting more funders to support this work, right? More collaborative partners of like mind, like spirit, to be a part of the HEEAT Lab in this important work. So one of the things that I also love to leave my audience with are additional tools, additional, things. What are the people, organizations, books, or movements that inspire you in your work in health equity? I mean, we're at a time where I know myself, I am constantly looking for inspiration, right? To stay filled up right? And not be discouraged. So as you're moving through this work and over the years, right? Because this isn't our first time of things being difficult. Let's just say that, okay? But what are some of the things that really motivate you and keep you moving forward?
A lot of things keep me going. I think faith, of course, and heart for the work. Right now, I do a lot of reading too to kind of keep me engaged and give me direction. So right now I'm reading Let This Radicalize You. And it's Organizing and the Revolution of Reciprocal Care. It's a book by Kelly Hayes and Mary Ann. It's a really, really, really good understanding of how you organize people to mobilize them for change.
Thank you for sharing that title. I'm gonna have to look into that and lean in some more into what that has to share. And I hope my audience does too. Thinking about, even people whose careers that inspire us, or organizations that we look to and say, wow, that's awesome. I would love to be able to do something like that. Is there anything like that or any person like that for you, Schenita, that maybe you look to? And I definitely appreciate where you're coming from, Ragan, in regard to lifting up our faith, which is very critical.
The first thing that comes to my mind in answering that question is an unlikely answer, but it is actually a faith-based organization that I have been affiliated with since college. And the leader has just signed an agreement with a major healthcare organization where they will build on their faith-based organization has 65 acres of land.
Wow.
And they're partnering with a healthcare organization to build a facility on their land and partnering with them, this faith-based organization, to deliver healthcare, particularly in that particular community. They have mobile units that will come to the community for regular screenings. And I have been inspired by that in terms of health equity, because it is holistic in the church bringing, there's power there, right? This land belongs to us and we're keeping it. There's a food desert here. There's health needs that need to be met here. So it looks at the whole self. So that has been a movement and an organization most recently, I think, that has inspired me. Like, it's inspired thinking around how we are to address equity. It also puts the ownership and the power in the community, right? The power doesn't lie with us. The power really lies within the community. How we can position ourselves to be facilitators and partners with them. Whereas our normal work has been, we've been seeking them out as partners. Oh, they know how to do this. The community knows how to do the real work of addressing health equity. And so how do we position ourselves to be servant leaders for the community to be able to continue to build and sustain in this way? And so it's really caused me to reframe and rethink my positioning as a researcher and as a scientist. But I've been very encouraged by the health equity work that they are doing. That is a business model, sustainable, and very impactful.
And I appreciate that too, because by sharing these types of resources, my purpose with Questions You Didn't Ask is to make sure that people understand you are not alone in this fight to advance health equity and to build towards health justice. There are a number of partners and organizations and ways to innovate. You don't have to feel helpless. You don't have to feel hopeless. You don't have to feel as though your dreams are, far off and far away. Yeah, it's going to take some work and it's going to take some time and some investment and things like that. But there are examples of people who are doing it that you may be able to learn from and cut that timeline down. right? And so what we want to do is to help facilitate collective action so that we can start to be the change that we wish to see in the world, right? And so, final thoughts. Is there a message you want our listeners to take away about health equity, community, and the power of doing it for ourselves as we close out?
Yeah, I think I'd say health equity is everyone's work. And as I said earlier, ain't nobody coming to save us. So part of being radicalized to organize is, like Schenita said, organizing the troops on the ground, the grassroots community, in order to get where they need, how they want to get there.
Yes. Thank you, Ragan.
Yeah, I would just say the last part about the power of doing it for ourselves, that realizing that this work is hard. And particularly where we are now in our society, it's a lot of things. It's hard, it's disappointing, it causes a lot of emotions. And continue to do the work, but also continue to find space of peace, space for restoration, space for hope, and space for yourself individually. Because if you cannot take care of yourself, then you can't do this work. And so just finding that whatever that looks like for you as you continue to do this work around health equity, just make sure internally that we are taking care of ourselves holistically. And that's a message for Schenita.
I can relate. I resonate as well, Schenita. I think it's for you, me, and everyone else that is listening today, is that we do have to remember that this work is worthy, it's important. In some cases, it's even critical, right? It's a necessity. It is hard. But what's also a necessity is that we have to take care of ourselves before we can take care of anybody else. And so that I appreciate that reminder. And with that, I want to say thank you, Dr. Schenita Randolph and Dr. Ragan Johnson, for joining Questions You Didn't Ask and making this such a wonderful, rich conversation and allowing us to learn more about your work, your leadership, and your research. Thank you.
Thank
Thank
you
you for having us.